Every time you stand up, it hurts. Chronic hip pain ruins your sleep, steals your mobility, and shrinks your world. When the pain gets this bad, you face a distinct choice. Do you wait for a free operation through the NHS, or do you pay out of pocket to go private? To evaluate that choice, we are using data from the 2026 UK Guide to Private Hip Replacement Surgery, compiled by The Best of Health, a trusted healthcare resource for the over 50s. Their research forces us to ask a practical question. Why are thousands of UK patients spending large sums of their own savings on a procedure the state provides at no cost? Answering that requires looking past the surface price tag. We need to understand exactly what that money buys, in terms of time, physical preservation, and certainty. This matrix compares clinical outcomes. The data shows a 97% success rate for functional improvement, regardless of whether you use the NHS or a private hospital. With clinical results effectively identical, the private fee addresses time, bodily preservation, and control. The true differences lie entirely within these three areas. They dictate how long you have to wait in pain, how much your physical condition degrades during that wait, and how much authority you have over your own surgery. This makes the decision a lifestyle calculation. You are exchanging financial capital to regain half a year of active, pain-free life. Looking at this timeline chart, the 2026 NHS reality becomes clear. The orthopedic backlog pushes the average wait to 27.4 weeks. Compare that to the private timeline of just 4 to 6 weeks. The gap spans 21 weeks. Waiting over 6 months triggers a period of active physical decline. Months of severe inactivity degrade your body. Muscles shrink, weight increases, and the joint itself becomes painfully stiff. By the time your NHS date arrives, your body has more ground to make up. Patients entering the operating theater in poorer physical shape face a much slower and more difficult post-operative recovery. Opting for private surgery stops the clock on that decline. It ensures you go into surgery stronger, which helps you come out the other side faster. This bar chart analyzes 2026 data from 176 UK hospitals. Prices across major private providers range from £10,300 up to £20,000. A Medline establishes a national average of roughly $15,100. This is the baseline number for your financial planning. Most hospitals offer a fixed price package covering the surgeon's fee, anesthetist, the implant itself, theater costs, basic follow-up care, and a private room. However, preoperative imaging like MRI scans and extended physiotherapy usually carry separate charges. If you have underlying conditions like diabetes or heart disease, hospitals require additional preoperative tests to ensure your safety. These mandatory screenings typically add £200 to £500 to your final bill. Treating this £15,000 expenditure as a predictable contract rather than a vague medical bill allows you to measure if the return on investment aligns with your retirement budget. The private pathway also secures autonomy. On the NHS, a surgeon is allocated to you, and you may not know who it is until the day of the operation. However, privately, you guarantee a named consultant. You can use databases like the National Joint Registry to independently verify that surgeon's track record and specific experience before you commit to their care. That autonomy extends to your hardware. You collaborate directly with your chosen surgeon to select the right implant, whether ceramic, cemented, or uncemented, based on your specific bone quality and activity level. Your environment changes too. You recover in a private room with a dedicated bathroom, and you see the exact same consultant at every stage of your recovery process. Paying for private care moves you out of the broad hospital trust system. You transition from a passive participant into the active director of your own healthcare. This decision tree helps map the data to your personal reality. Your optimal pathway depends on your weight tolerance, your budget, and your medical complexity. The NHS pathway is appropriate if your current wait time is manageable, if a £15,000 bill would cause financial stress, or if complex health needs require immediate intensive care backup. The private pathway serves those whose daily pain is actively degrading their quality of life, who value total control over their care, and who have the budget ready to deploy. If the budget is the only barrier, many private providers offer 0% finance options spread over 10 to 12 months to mitigate the upfront cost. There was no universally correct choice. The right pathway is strictly determined by how you personally weigh the cost of your money against the cost of your time. You can remain on the NHS waiting list while exploring private quotes without penalty. The return on investment for private surgery comes down to an exchange of roughly £15,100 to bypass a 27-week wait, preserve your muscle mass, and guarantee complete surgical control. To run your own calculations and read guides on private costs and surgeon research, visit thebestofhealth.co.uk. Whether you choose the NHS or the private sector, regaining your mobility and returning to a pain-free life is entirely within your reach.